Hi, I'm Dr. Craig Escude, President of IntellectAbility. Welcome to Medical Monday. Our topic today is another one of the fatal 5+ conditions, the preventable causes of illness and death in people with intellectual and developmental disabilities. Today we're going to talk about seizures. Seizures in people with intellectual and developmental disabilities are the most difficult, the most severe and the most difficult to treat. It can be very, very challenging to stop seizures, to keep people from having seizures in this field. And people with intellectual and developmental disabilities have a higher incidence of seizures. About 25% of people with disabilities have seizures, and the more significant the level of disability, the more likely the person is to have seizures. So what is a seizure? So basically a seizure is really just kind of an electrical storm in your brain. And depending on where that little electrical storm is, that's what's going to affect how the seizure is going to look. So one of the most common things that we think about when a person has a seizure is that they start shaking all over their bodies and they fall to the ground and they foam at the mouth and that type of thing. And that is what we call a generalized seizure. The different term is a tonic-clonic seizure. There's different terminologies you can use for these different types of things. But that type of seizure is again, that's typically what we think about. But very often seizures can present in many different ways. They don't all look like that big type of seizures. It might be just a repetitive hand movement that a person has for just a few seconds. It might be that they stare into space for a second, just like I did, and that's all you noticed. It could be that they have what some people might consider aggressive behavior, when really what they're doing is having an actual seizure. They might suddenly fall asleep. That could be a seizure. There are some actually really other interesting things like people disrobing, taking their clothes off, or sometimes even acting out in some weird or different or strange, unusual way. Even a sexual way or an aggressive type way. It may be yelling or screaming, just screaming some words for a few seconds or some sounds for a few seconds. That could be a seizure. And many times we miss these things because we think that people are doing this just because, well, that's just what they do because they have a disability. And we don't recognize that these could be signs of a seizure. So if you see these types of things, you should bring these behaviors to the attention of a medical person, and let them know that, hey, could this be a possibility that they're having seizures? When we talk about seizures, there are lots of ways to treat seizures. One of the first things that we do is use medications. Now, the problem is that not all of these medications work the best. It's true with anything. Not all medications treat every condition perfectly. And a lot of the seizure medicines can have significant side effects. And one of the biggest side effects is sedation. So we don't want to put people on medicines that aren't needed. We don't want to overuse medicines if we can. And that's a very common thing in this field. We call that polypharmacy, where people are on lots of medicines that they don't need. But seizure medicines can be very helpful, and when appropriately prescribed, they can be very important and life-changing to people who have seizures. Now, you might have a person who's on medicines and they're still having seizures, but something to remember is that maybe they're better with the medicine than without the medicine. Meaning that maybe they're having less seizures than they would be, even though we can't completely control their seizures with the medicine. Maybe their seizures don't last as long as they used to. Maybe the period after the seizure that we call the post-ictal period, where people are often sleepy and groggy, maybe it's only lasting 5 minutes instead of an hour. So these are still benefits to people being on seizure medicines, but we always need to be aware of what medicines people are on, what particular interactions that they might have as well. So that's a little bit about seizures. If you want to learn more, the clinical pearl number 22 is about seizures in people with intellectual and developmental disabilities, and it's found in the book Clinical Pearls in IDD Healthcare, and you can find it at replacingrisk.com. Thanks for joining me on this talk, this electrifying talk today, and we'll look forward to seeing you soon.